Hi, my name is Kylie Myer, and I'm a postdoctoral researcher here at the UT Health San Antonio School of Nursing. Since the COVID-19 pandemic began, we've been worried about to what extent loneliness may have been affecting our health, especially given the social distancing requirements that we've been doing in order to prevent the transmission of the virus. In today's talk, we want to talk about the relationship between loneliness as well as sleep quality because we know how important sleep quality is to our overall health. So before we dive into that, first I want to distinguish between these two terms that we often talk about interchangeably, loneliness and social isolation. And why does it matter, this difference between them? Next, I want to share with you how COVID-19 may have affected how lonely we felt as a society and who was most at risk of feeling lonely. Then we'll get into how loneliness may have affected our sleep quality, in particular, how it might have affected our sleep quality because of changes in our mental health. And lastly, we'll go through a few ways that we may be able to improve our feelings of loneliness to feel more socially integrated and also to improve our levels of sleep quality. So, what does it mean to be lonely? And then, how does loneliness affect our health? Let's kind of back up for a minute and talk about this idea of social connectedness overall. When you're socially connected, it means you have a sense of belonging to a particular group. You feel engaged in the world around you. You feel a sense of togetherness, maybe with family and friends. The opposite of that experience is loneliness. And loneliness is referring to kind of the subjective perception that somebody has. So it's an emotion that somebody feels because they're not very satisfied with their level of social connectedness. On the other hand, isolation is more objective. So it's an actual lack of social contact with others. And what's really interesting and important to remember when we're thinking about the COVID-19 pandemic is you can feel alone even though you might not be isolated. And you can be isolated but still not feel alone. I'll do a dramatic repetition of that because I think it's so important. You can be isolated, so you could be socially distanced from others around you, but not feel lonely. So how do we do that is one of the things we'll be talking about a little bit later in these slides. So I like to illustrate this point with a piece of art here. So if you look over here on the right side of the screen, you'll see a painting that was made during the Romantic period. And if you remember your art history classes, you'll recall that during this time, the individual was celebrated. And so here we have this individual who's gazing out over the sea, and he's certainly isolated. He's alone, but it's not shown in a negative sense. You do get the sense that he's particularly lonely. It's maybe he's feeling reflective or contemplative. Um, and so I think this image captures how we can separate out loneliness from isolation here. However, when we do find that somebody is feeling lonely, we do start to have some concerns about their overall health. And that's because loneliness has been associated with a lot of chronic conditions, things like higher blood pressure, increased risk of stroke, mood disorders such as depression and anxiety, cognitive impairment or dementia, as well as mortality. And I want to dive into that last point just a little bit more in terms of how loneliness might be affecting our risk of mortality. And this is a chart from a study that's called a meta analysis. And if you go back to your research methods class, a meta analysis is a study that people do to take all the studies, individual studies that people have done on a particular topic and just kind of summarize them. And there's a lot of stats that go into it, but all of this is kind of saying, in a nutshell, what is the relationship between feeling socially integrated or less lonely and mortality? And so this is actually kind of an infamous figure within the field because if you've ever heard the expression that feeling lonely is similar to your health, as it is to smoke a pack of cigarettes a day, this is really where that expression came from, and it's a little bit more nuanced than that, but if you look up here at these top three rows, it's talking about the effect of social relationships and social integration on risk of mortality. So if you go from 0, this is your lowest risk of mortality. 1 is your highest risk of mortality. And you can see these bars here that stacks up these feelings of feeling socially integrated against all these other health behaviors that we know are associated with mortality, including whether or not you smoke more than, or in this case, less than 15 cigarettes a day. So this chart is saying if you smoke less than or fewer than 15 cigarettes per day, you have a lower risk of mortality than if you smoke 15 or more cigarettes per day. And so that's a large number of cigarettes, and so it's why the expression of it's like smoking a pack of cigarettes is a little bit tricky to interpret, but we can see here that being socially integrated definitely does lower your risk of mortality to the extent that it's comparable with these other health behaviors. There's another study that was done, it's a few years ago now in 2007, but I think it's still quite innovative in that these researchers took a group of people who felt more isolated or more lonely, and then a group of people who felt more socially integrated. And so I just want to clarify, they say isolated on this chart, but they really mean lonely. So it was that subjective experience they were looking at. And they found that people who felt lonelier actually had different levels of gene expression. So people who felt lonelier had gene expression that was indicative of higher levels of inflammation, and that's that not so good type of inflammation that we know is associated with things like cardiovascular risk. So loneliness can in very real ways affect our health. So that brings us to the question of what factors increase one's risk for loneliness, and did COVID-19 make us lonelier? So, outside of the pandemic, we know there's a couple of things in our lives that could make us feel lonelier. One of them is the opportunity to engage with others. So, if you live alone, you're a widow, maybe you're living with a disability or a health condition that makes it difficult to leave the home, you might have lower income that lowers opportunities to participate in activities. These are things that affect a person's levels of loneliness. We also find that younger people tend to be a lot lonelier than older people, kind of peaking right before you hit age 20, and then it goes down from there on average. Spending less time outdoors, and as well as worrying about COVID 19. So that came up in the pandemic. People who have more anxiety or worry about COVID 19 also expressed higher feelings of loneliness. Loneliness can also increase during times of transition. And as a caregiving researcher, I'm really interested in how it affects caregivers. So, whereas about 1 out of 3 people in the general population say that they are lonely at any given time, this is closer to 1 out of 2 family caregivers to a person who's living with dementia. And you can think about a lot of reasons why that might be. Um, Going back to how a person's mood might affect their or perceptions of loneliness or their satisfaction with their level of social connectedness, we know that caregivers feel more stressed, higher levels of depression, and don't report as high a well-being as non-caregivers or even caregivers for somebody who's not living with dementia. And so we think all of these factors may be affecting their experiences of loneliness. And so there's been a few studies now looking at to what extent COVID-19 made us lonelier. And I have to say, some of them aren't as, quote unquote, doom and gloom as the media would have us believe. At the same time, we have to note that we're talking about the average person when we're talking about these big research survey studies. So we might have had a part of the population who felt very, very lonely. People who were much more vulnerable. You might be thinking about nursing home populations who were very limited in their ability to see family members and friends. However, if you look at some of these large national surveys that have come out and are still coming out, we actually don't see these big differences in loneliness that we might have expected given social distancing requirements. So this is a study that where the researchers took a survey done online and first took administer the survey in late February, then in late March, and then in late April, so very early into the pandemic in 2020. And they found actually not very large differences in feelings of loneliness in this sample. What they did find, and this is somewhat hopeful, is higher levels of perceived support. So while we were worried about the COVID-19 pandemic and we were socially distancing, we were also on average reaching out to our friends and family a bit more. On the other hand, we do see, and this is from another survey study, very high levels of loneliness still. Um, Even if we don't see a lot of change, say from May to June in this survey, so it goes a little bit further into the pandemic, we're still talking 1 out of 2 people expressing high levels of loneliness. So not just feeling lonely, but kind of crossing a threshold where we're kind of going, this is above and beyond what's quote unquote normal. And so, um, one of the things the survey also found is that people who were living in shelter in place areas, so where there was a law that said, you have to stay within your homes, did feel lonelier. So policy was affecting loneliness. And we see that again here where during the lockdown phase, we had very high levels of feeling loneliness, about 1 out of 3. And I know these rates are differing, and this is because of the slightly different study populations that each of these surveys is getting at. We had about 1 in 2 people saying they missed social contact, but then once this particular culture went into this reopening phase, we do see those levels going down, suggesting that it wasn't there was a dynamic change in feelings of loneliness throughout 2020. All right, so let's get into kind of the other part of our talk, which is the importance of sleep for our health and how might have COVID-19 and feelings of loneliness that many of us were feeling during COVID-19, how did that affect our sleep quality? So first, I'd like you to take a moment and just reflect on how much sleep do you get per night? 7 hours, 8 hours, just on average. What time do you wake up during the day or in the morning? What time do you go to bed at night? Do you wake up in the middle of the night? Now think about how these patterns changed during the COVID-19 pandemic. Did you find yourself staying up later, maybe reading news stories about the pandemic and what we were learning about the pandemic, maybe in late spring 2020? Were you sleeping in later because maybe you didn't have to wake up to go into the office, you didn't have to commute to work? Were you sleeping more and feeling more fatigued during the day? All right. So you may remember this, but adults in the US, or adults anywhere really, are recommended to get 7 to 9 hours of sleep per night. And the amount of sleep that we need during our lifetime changes throughout the life course. So adolescents tend to need a little bit more sleep, so we notice them sleeping in a little bit more. But on average, this is about the right amount, and there is variation in that. And so if we take that 7 hours as kind of the minimum amount of sleep that a person should be getting per night, about 1 out of 3 American adults don't get enough sleep. So they're sleeping less than 7 hours per night on average. And there's a lot of reasons we're worried about this. We know that poor sleep quality is associated with things like higher blood pressure. So this is another one of those meta-analysis studies where they took a whole bunch of research studies that were completed across the globe, and they looked at what is the relationship between poor sleep quality and having higher blood pressure. And you can see kind of in this illustration where a lot of these marks are ending up on the right side of the screen here. So that's indicating to us, and those are demonstrating the effect size from each study, that um, that if you have poor sleep quality, you're more likely to have higher blood pressure or higher systolic blood pressure. Blood pressure in this particular image, although they did find diastolic blood pressure, that bottom number is also affected. People who don't sleep as well, so they're sleeping for a shorter amount of time, also are more likely to catch a cold. So 4 times more likely in this study by the University of California, San Francisco. And this was a study that was done prior to COVID-19. And so you can only imagine if we're thinking about if you're not sleeping as well, your immune functioning might be compromised, and then you throw in a pandemic. So not a very good situation when we're thinking about possible disruptions in sleep during the COVID-19 pandemic. All right, so how did COVID-19 actually affect our sleep? What does the data say? Well, first, we want to recognize that people who were diagnosed with COVID-19 do report more sleep problems. And there's a lot of reasons this may be. There's the anxiety around the trajectory of the disease. There's the experience of the symptomology of COVID-19, things like difficulty breathing that affect a person's ability to fall asleep and stay asleep. But then, if we look at people who are not diagnosed with COVID-19, we also do see changes in sleep patterns. So, early in the pandemic, and unfortunately, I have to confess that our research is a little bit biased right now, and that the studies that we can report out on are primarily from, summer, or excuse me, spring and summer of 2020. A lot of the research data that was collected in the fall and the winter of 2020, and even now into the spring of 2021, hasn't been published yet. And so that's the unfortunate part of research taking so long to be created and disseminated. Um, so we do expect that there would be changes over time. But from what we can tell from these early weeks and months of the pandemic, we do notice some changes in sleep quality. And one of the things that we find is that people tended to go to bed later as well as to wake up later. And so the authors hypothesized that this was related to anxiety people were feeling. So maybe you have thoughts racing through your mind, affecting your ability to fall asleep, disrupted routines. Again, so if you don't have to wake up for a job, maybe you're going to sleep in a little bit later to make up for that time where maybe you couldn't fall asleep as quickly as you would have liked at night. And so this is a graphic from a study that was done in Italy. And again, I'll fess up the biases here, where the survey was done primarily on adults who were under the age of 30. And so they split it into students and workers within that age group, and it was all done online. And they were looking at multiple outcomes of sleep. In this case, they're looking at the outcome of the amount of time spent in bed. And we see that people's reporting of the amount of time spent in bed before the lockdown was about 8 hours for workers. And by the time we got into the lockdown, they were reporting spending almost 9 hours in bed. And so, time in bed, of course, doesn't always mean that you're sleeping. You might be staying up trying to fall asleep. So, we do notice some changes there. However, oh, excuse me, I'll go to my next slide here. So there are a couple of people who may have been more at risk of low quality sleep during the COVID-19 pandemic. So people who were experiencing higher levels of depression and anxiety symptomology, they were more at risk of low sleep quality. Similarly, people who had higher perceptions of stress had poorer sleep. People who spent more days at home, so people who might have been affected by social distancing requirements, as well as who felt it wasn't safe on their own to be engaging with others, um, did report lower sleep quality, and we'll go into why that might have been in just a minute. And then people who maybe were more exposed to COVID-19, you could say, so healthcare workers and people who knew others who were affected by COVID-19. So there might have been more worry and anxiety about um, receiving an infection, about the well being of those affected by COVID 19 among these individuals. And so the big question mark is, were people who were lonelier, were they more likely to report low sleep quality? And I'm so sorry to say I can't give an entirely satisfactory answer to that question. And that's because it's a really complicated relationship. So, if you've ever woken up one day after not getting a very good night's sleep, you might have found that you were a little bit grumpier, maybe a little more critical. You noticed more negative things in your environment than you might have when you had a full night's sleep. And so, that change in our perception when we're tired or fatigued also can affect our levels of loneliness. So, again, loneliness is our satisfaction with the level of social connectedness that we have. If you're sleepy, tired, grumpy, maybe you're less satisfied with how socially integrated you feel. You might feel lonelier. Similarly, we are social creatures. Loneliness is a form of stress among people, and so that can also affect our sleep quality, because we know when we're stressed, when we're feeling anxious, those are not good circumstances to get a good night's sleep. So we're still trying to figure out the exact pattern of how these different variables might have fit together to affect sleep quality. So here I throw in this experience of stress and anxiety as well in the image on the right. So again, loneliness is a form of stress that can affect our mood and ability to fall asleep. So if you're staying up at night worrying, potentially the next day you feel more tired, and then you feel more lonely. You feel more lonely. Maybe you feel more anxious because you're stressed about feeling like you don't have that sense of integration, and then that could affect your sleep in a kind of a cyclical manner. The other thing that could have been happening is that because loneliness is again this form of stress, we might have changed our health behaviors. So, for example, a lot of people suffer from sleep apnea, so difficulty breathing during the night, which could cause you to wake up in the middle of the night. And it's really important that you get treated for that, of course. One of the things that we know with sleep apnea is that weight gain increases your propensity to feel the symptoms of sleep apnea, the severity of it. And so, during COVID-19, maybe you had less opportunities to exercise. Some people struggled with managing their diet during COVID-19 because of changes in routine, such as needing to have more food in the house, given limited ability to go to the grocery stores regularly, given fear of transmission. And so that weight gain could have affected sleep quality, as an example. Now, we have done a little bit of our own researcher here at the Caring for the Caregiver program at UT Health San Antonio. And in this study, we asked spousal caregivers to a person who was living with dementia to excuse me, to complete a survey every day for 14 days. And so when they completed this survey, we asked them about their physical health symptoms, their sleep quality, as well as their level of social integration in their relationships. And we found that on days when caregivers felt more lonely, so they reported on their survey they felt more lonely, they also reported poorer sleep quality. So this is the results from what's called a regression analysis, where we kind of hold equal all of these other things that could be affecting sleep quality, things like a person's age, the extent to which the caregiver was affected by behavioral symptoms of dementia and had to manage those for the care recipients. So things like wandering, paranoia, anxiety, these behaviors that come with dementia oftentimes. So controlling for these things, caregivers' sleep quality was poorer on the days that they felt lonelier. Similarly, we also found differences in physical health symptoms. So on days when caregivers felt lonelier, they also reported having more physical health symptoms, things like having a headache, feeling fatigued, all of those kinds of things. There are a couple other things that might have explained why COVID-19 affected our sleep quality through social connectedness. So we know when we were socially distancing and may still be socially distancing, depending on the level of risk that you're assessing in your life. When we don't leave our homes, we're limiting our exposure to sunlight in many cases. And sunlight's something that's pretty important to us in order to regulate our circadian rhythm. So when you're not exposed to bright light, such as sunlight during the day, it kind of messes with your brain so that you may have more difficulty falling asleep at night. Similarly, when we're going to go to sleep at night, so when we're kind of winding down for the evening, we want to have more dim lighting, indicating that it's time for rest now. When isolated, we might not have been as physically active. And physical activity is something else that is supported or supports higher sleep quality. As we talked about, social distancing and the uncertainty around the pandemic also created a distressful situation for many that kept us up at night. And then, of course, we did have disrupted routines. And one of the things I'll go into as an example for caregivers is that um, when we no longer had routines such as being able to go to adult day services, maybe it was taking care of a child who was usually at school and is now completing schoolwork at home. These individuals who we take care of also are affected by the loss of routine. So what we found among family caregivers is that they reported that people who are living with dementia were exhibiting more behavioral symptoms of dementia, which we think again has to go do with that routine. And so when you're managing these behavioral symptoms, they can happen during the day and they can happen during the night. And so a lot of caregivers may have had issues falling asleep and staying asleep because their family member might have been wandering or needed them at night because of these behavioral symptoms. All right, so let's get to some solutions here. How can we prevent loneliness and potentially improve our sleep quality and health in doing so? So, first, group-based and peer-to-peer activities are, of course, a good way to decrease feelings of loneliness. However, we had limited opportunities to do these kinds of activities because of social distancing. We did find that a lot of people found new ways to connect during COVID-19, however. So in this image on the left, this is an image from our Memory Cafe program run by Sarah Massoud at Caring for the Caregiver, where caregivers and family members who are living with dementia started to meet by Zoom each month during the pandemic, so beginning early in the pandemic, to engage in reminiscence discussions, to listen to music together, to play loteria, or Mexican bingo is how we kind of translate it. And so this was an opportunity to be together and engage in a meaningful way. And the interesting thing is too, is even if kind of the antidote to loneliness isn't always being more socially connected. It isn't always being around people more often. Another way that you can relieve feelings of loneliness is to engage in meaningful activity. And that's going to depend on the person, what that looks like. So it could be your job, it could be reading, it could be physical activity. Writing letters has actually been found to be effective. Um, and then also human animal interactions. And I know if you had a fur friend with you during the pandemic, but you might have leaned on them a little bit more than usual to cope with some of the additional stresses you were experiencing. And then, of course, calling family members and friends. And then lastly, how can we improve our sleep? And we kind of touched on this a little bit, but just to kind of summarize these different good ideas you can try, you want to maybe try to increase your exposure to sunlight during the day. So if you can get out for a short walk, that might be a way to kind of signal to your brain, it's daylight now, we're going to be awake and alert, and then, separate that out for nighttime, which is the time for rest. Trying to practice good sleep hygiene. So trying not to do anything in bed that is not, sleep or intercourse. And so activities such as watching television, doing work in bed, that can condition your brain to think, oh, well, bed is for being awake. And so if we can condition our brains to think about the bed as a place for only the activities that are most appropriate for bed, that's going to help us to fall asleep. Next, exercise. So you want to get more physical activity during the day. And I say during the day because if you do engage in physical activity late at night, towards when you're going to bed, what we find is actually you might have a harder time falling asleep because when we exercise, we release the hormone cortisol. And so that kind of helps us to stay alert. It's known as kind of a stress hormone. Um, and we actually want our cortisol levels to be steadily decreasing throughout the day, signaling at the end of the day that it's time for rest. And then next, this is going to sound a little odd, but try to find times to be worried throughout the day. So dedicated time to reflect on your worries and concerns through journaling, talking to a friend. And what this does is it helps us from having those worries kind of flooding our brains at night and keeping us up. And then limiting your exposure to negative media. There was a study among family caregivers that indicated those who engaged in or viewed more negative types of media which might have increased their levels of anxiety. So reports about fatality rate potentially of COVID-19 and other things that could be anxiety producing, um, that actually prevented them from falling asleep at night. Maintaining a routine. So even if you can wake up later during the day, try to wake up and go to bed at the same times every night. And then keeping the bedroom, again, going back to that conditioning, dark so we don't have sunlight leaking in. Cool. We oftentimes fall asleep more quickly when we are a little bit cooler. The temperature is a little bit lower than what we might find comfortable during the day. And then a calm space. So it's not a place where we're trying to feel very, very alert. So thank you so much for tuning in today. I hope you had a chance to learn something new about COVID-19 and how it might have affected our health behaviors, such as sleep, through the experience of loneliness and anxiety. If you do have any more questions about this topic or would like to share something that you've learned or from your experience, please feel welcome to reach out. I place my email there as well as my Twitter handle, where I do occasionally spread information about recent events going on for caregivers and related to research in this area. Thank you so much and have a great rest of your day.